Hello and welcome back to the Pain Free for Life podcast. I'm Dr. Rob Vanbergen, and today I'm joined by Dr. Kevin Connors. Dr. Connors is the clinic director at Connors Clinic, an alternative cancer coaching center. He graduated with his doctorate from Northwestern Health Sciences University in 1986 and has been studying alternative cancer care for over 25 years. He also holds AMA fellowships and board certifications in anti-aging medicine, regenerative and functional medicine, botanical medicine, and is board certified in integrative cancer therapy. Dr. Connors is also certified in functional neurology, has had over 300 hours postgraduate study in the autism spectrum disorders, and is trained and certified in epigenetic clinical methylation and nutrigenomics. He has written numerous books, including Stop Fighting Cancer and Start Treating the Cause, and The 7 Phases of Detoxification, all of which are available at connorsclinic.com. In today's episode, Dr. Connors and I discuss the prevalence of chronic pain in cancer patients, the potential of rife therapy and other adjunct therapies that can be used to help with cancer patients, as well as parasympathetic stimulation and impacts of pain on mental health, highlighting, of course, the importance of mindset.
Welcome back to Pain Free for Life, where we share how to successfully overcome all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And now, here's your host, co-founder, and board-certified holistic healthcare practitioner, Dr. Rob Vanbergen.
Dr. Connors, welcome to the show.
Oh, I'm great. So glad to be here. We're talking recently, so it's just so nice to continue our conversations.
Yes, I agree. I think, we talked quite a bit before about chronic pain, so I think we'll kind of start there. And I know you work a lot with patients that are in dealing with cancer, right? So a lot of the time, people that are dealing with cancer are kind of in extreme pain. They're kind of at the end of their tether. So what would you say are some of the main causes of pain for cancer patients? And in that, why is it so difficult to manage compared to other types of pain?
Well, probably the number one cause of pain for cancer patients is the metastasis. So if a person has metastasis, typically cancer, one of the signs of cancer, let's say I have a lump in my breast, if it's painful, that's usually a sign that it may not be cancerous. So it's not always this case, but many times the primary cancer is not painful. When you have pain with cancer, it's more commonly when the cancer is metastasized. Worst case is metastasis to bone. And then if you end up with a pathological fracture of a bone, then you have pain because you have pressure on a nerve. And that can be very difficult to manage when you just have, direct pressure on a nerve pathway. It makes it much more difficult. And then the other side of pain with cancer is ascites is common with abdominal cancers and abdominal ascites, or even cancer that's spread to the lungs and you have ascites in the lungs, because that's probably the worst form of inflammation.
Do you think that people also experience pain from the therapies, or does that not really, if people are doing chemo, does that create pain in a lot of cases?
Well, chemo doesn't typically create pain. It creates a lot of other comorbidities, and which may lead to pain, but the drugs themselves are typically the cause of pain, at least directly the cause of pain.
Okay. And so just so that people in the audience who don't know understand, so metastases, can you just define that for the layman?
So metastatic cancer is different than primary cancer. So when you talk about primary cancer, that's where it's initially started. So if I have breast cancer, it initially started in the breast. If it's spread to the lymph node, now it's metastasized to the lymph node. If it's spread to the liver, now it's metastasized to the liver. That's now metastatic cancer. It's still breast cancer cells in the lymph node. That's a common misconception. It's not liver cancer now in the liver. It's still breast cancer cells that have basically set up home, are raising a family in the liver. So we still treat it with the same medication / nutritional protocol. You may do some things differently, but it's still the same cells that's now, attacking a different organ, attacking the bone, some other tissue site.
Right. Okay, perfect. Good explanation. So I know that at your clinic, you guys work with Rife a decent amount, right? So you've worked with it before. Now, Rife therapy is something that many of our clients are really interested in for a variety of different things. I hear about it a lot for like treating parasites, but I have heard about it as far as cancer goes as well. Do you use it primarily for the treatment of pain? Do you use it to help people when you're actually doing a treatment plan for someone with cancer? Does it have kind of both capacities?
Well, Rife, there are some programs so Rife is frequency medicine. Simple, your listeners are very in tune to using frequencies, but it's not electrical frequency, it's light frequency. Now, that's my definition of Rife. So Rife is using frequencies, but Royal Raymond Rife really had a success using light frequency through a Tesla tube or a plasma tube. So it's light frequencies that are coming through the body. Can Rife light frequencies help directly with pain? Yes, there are some frequencies that are known to help with pain. Is it why we use Rife? No. So the best use of Rife, just like any tool, you don't use a hammer to screw in a screw. You want to use the tool, the best that tool is to be used for. Well, in my opinion, Rife technology is best when it's attacking living cells or living organisms. So it's like you mentioned, it's great for killing parasites or bacteria or viruses or fungi or things like that. But it's also great to help your immune system kill cancer cells. It's great to help bring proper, frequencies back to the organs and the tissue. So for a healthy person to use Rife to stay healthy, because everything, including your cells, including your tissues, including your organs, vibrate at a specific frequency. And if that is disrupted due to toxins and chemicals and frequencies and EMFs in our environment that are disrupting our body's frequencies, then we can have ill health and disease start. That could be a piece of the cause of disease. That's how EMFs can cause brain cancer and things like that. Because as frequencies, normal, healthy frequencies of normal cells are disrupted, then disease process can set in.
Yeah, I'm glad you frame it kind of the same way I do with people as well. I talk a lot about how Rife frequencies are great for destroying pathogens, essentially, right? You can get in, you find that exact frequency, and you can eliminate that parasite. That's something that we know that microcurrent is not great at doing. Microcurrent it can help your immune system, it can increase circulation, but it doesn't seem to actually deal with the underlying pathogens in any way beyond enhancing your body to be capable of pushing past that. So we use a bunch of different therapies, and I think you're probably going to be familiar with some of them. We use PEMF, pulsed electromagnetic fields, which I think you guys use. We use microcurrent. We also even use scalar energy. Have you had experience with many of those, or just really with
Sure. And it goes back to using the right tool for the job, right?
Mm-hmm.
So if a person came to me and said, I really have pain in my knee, can I use the Rife for that? You can, but I would choose, microcurrent or PEMF for that, before I would use Rife technology for that.
Mm-hmm.
But if that's all you have is a Rife, certainly there are frequencies that might help, but that wouldn't be my first choice. So it's trying to tailor the treatment plan to the needs of the patient.
Right. Yeah. And understanding that we have all of these tools, as you said, that are very specific to different things that you can do with them and need to do with them. It's like building out a toolbox. So we're all equipped for whatever we're coming up against. Right.
Right. Yeah.
So PEMF aside, like, are there any other therapies that you recommend that people would use for pain? PEMF, Rife, or is it really kind of in that tool set of frequency medicine?
Well, and those are pieces of equipment, and not everybody has the ability to, go to a practitioner. We have people that are out in the middle of nowhere and there's no practitioners with microcurrent or PEMF available. So you have to, use other ways to help with pain with some people. So one of the things that I teach is to try to stimulate. So I explain pain this way. So if I smash my toe on the side of the bed, today, where is the pain? Well, it's in my toe. Well, really? Is that where I'm feeling the pain? Or my toe just has receptors for pain that then are firing back up my leg and into the cord and cross over the cord and up to the brain into the opposite side of my parietal lobe. And that's where I'm actually feeling the pain. So can we harness that understanding of that neurological pathway to help decrease pain without using tools that a person might not have? So we teach our patients that have chronic pain that, okay, so let's say a metastasis to the bone, the person has tried radiation, they still have pain, they are using microcurrent, they're using PEMF, they're using rife, they're using every tool available, but they still have pain. There's some things that they can do at home on a regular basis to help mitigate that, and that's harnessing the understanding of functional neurology. So that's another piece that you could deal with. And if I can continue there, functional neurology is that understanding of those different pathways. So there is so pain is carried on one pathway. And then there's another pathway that comes from the tissue site back to the brain too. That's a different pathway. There's small diameter afferent pathways and large diameter afferent pathways, not to get too technical, but one can inhibit the other. One does inhibit the other. So if a person has pain because of, let's say I smashed my toe, if I stimulate the other pathway, it actually inhibits the pain. So one thing you could do with a person is, it's really easy for them to buy a little massager or a vibrator that they can put their foot on that same side, and it stimulates the other pathway, and that other pathway crosses over in the cord and it inhibits pain at the cord level. So by using vibration, also that pathway carries hot and cold, and light touch. So vibration, hot and cold, and light touch inhibit the pain pathway. So that's one way that they can do that. They can do that all day long if they want. Another way they could do it is up at the brain level. So the frontal lobe, the prefrontal cortex up here, inhibits the parietal lobe through another pathway. So I've had patients with chronic pain that is not going to go away because of this tumor is at the site and it's large and it's putting pressure on the nerve, and no amount of morphine is going to, inhibit that. They don't want to go on high doses of morphine. So by stimulating the prefrontal cortex, you are inhibiting the pain. And how do you do that? With novel thought, novel ideas. One easy, it seems so silly, a thing that I have people do is do jigsaw puzzles. So a jigsaw puzzle, even if you've done the jigsaw puzzle, the same one multiple times, it looks new all the time. So any novel, new study, so you're studying something new, you're learning something new. You are stimulating the prefrontal cortex, sending inhibitory fibers to the parietal lobe up here and inhibiting pain. So you feel pain, you feel hot and cold, you feel all these sensations in the parietal lobes up here. The right parietal lobe, you feel all the sensation on the left side of the body and vice versa. So if you stimulate the prefrontal cortex, you are going to inhibit pain. That's why people were like, well, I was studying and I was learning something new and I actually forgot about my pain. Well, that's because you were learning something new, firing the prefrontal cortex, inhibiting the parietal lobe. So it's just things like that we try to teach people. And I think I have some blog posts about this, and I have written a lot about this in my books, about how to use neurology as best you possibly can to also have another tool to inhibit pain that you can't take care of. Obviously, if you have pain, it's a sign that there's something wrong and you want to investigate that. But we're talking about that with the person that's investigated that is doing other things, as many things as they possibly can do. And maybe they don't want to go on, pain medication that can be very dangerous and hurtful to them in other ways. So they're trying to do as many things from a natural perspective as possible.
It's a really interesting point. I think I think everyone's probably experienced that before when whether it's pain or whether it's even feeling unwell in general, and then that distraction, right? Having that kind of distraction of something, as you said, learning something new, because I guess it has to be engaging in the right way, and then totally forgetting that they were dealing with that pain. It doesn't necessarily resolve it, but it certainly detracts from it during that time.
Yes, I'll give you a perfect example. I had a patient who had a very large rectal tumor that the surgeon did not feel comfortable removing it at the time because it was so, near the blood supply and the neurological system at that area. And it was very large. This poor woman, she wasn't even able to sit down. And she started doing jigsaw puzzles. And she said that's the only thing that would take her pain away. And so she was just addicted to doing jigsaw puzzles, she's retired all her waking hours. And that's the biggest thing until the tumor was able to shrink enough that they could do surgery. That's how she coped with the pain, is something as silly as that. But it's just kind of harnessing an understanding of your neurology.
Right. And you said that so it doesn't necessarily have to be like a brand new jigsaw puzzle, even the same puzzle done again because of the fact that of the way people build puzzles. Can that have the same effect, or does it have to be kind of a new process?
It has to be, to really stimulate the prefrontal cortex. You have to see, it has to be something novel or new. And the reason why I like jigsaw puzzles is because it's kind of new every time you do it. There's no way you memorized every shape of every piece of a 1,000-piece puzzle. So it is new, it's novel, but you could get the same effect of, some people will say, I hate jigsaw puzzles. But you could get the same effect learning something new. That's why you should never stop learning. Take a course online and you're learning and having to study and watch videos like this where you're engaged in learning something new. It's the monotonous television that isn't new. It's not stimulating your prefrontal cortex at all. It's almost putting you in a trance, and it's not helping, at least with inhibiting pain fibers in the parietal lobes.
Perfect. So I know you also talk a lot, and we talk about this too, actually, about parasympathetic stimulation. So getting out of that sympathetic state and into a parasympathetic state. So how can someone with chronic pain tap into the nervous system to kind of help decrease that pain, whether it's, I suppose, related to cancer or not?
So we talked about, dealing with the nervous system at the cord level by using light touch, vibration, hot and cold that stimulates and inhibits the pain fibers at the cord level, the spinal cord. We talked about inhibiting pain neurologically and from the prefrontal cortex to the parietal lobe. But the autonomic nervous system is not housed in the cortex of the brain. It's housed in a deeper part of the brain called the midbrain that's below these big lobes of our brain, deep inside there. And you have two parts of the autonomic nervous system. And if you think autonomic, think automatic. It's the part of the nervous system that is beyond our volitional control for the most part. It's what causes your heart to beat. It's what causes your liver to liver and your spleen to spleen. We don't even know we don't have to know any of the physiology. It's still functioning. And it's functioning because of the function of the sympathetic and parasympathetic system. That's the two sides of the autonomic nervous system. Now, when we have pain or when we have stress or anything, or when we haven't even perceived stress, we will become out of balance, or sympathetic and parasympathetic should be fairly balanced for the most part of the time, but it will be imbalanced often, and sometimes it's serving a purpose to be imbalanced. If a tiger jumps down in front of you, you need to have a healthy sympathetic nervous system, so you are imbalanced and you are in sympathetic overdrive at that time for the purpose of you to make quick decisions and either fight that tiger or run away. But if most people in today's society, at least in America, are kind of stuck in this fighting a tiger constantly, and so we get in this sympathetic overdrive that we get stuck in that situation, and that's very dangerous for our body. It can lead to all sorts of disease because our parasympathetic is responsible for our immune function. Our parasympathetic is responsible for all our liver detoxification pathways. Our parasympathetic is calming. It relaxes our endothelial muscles, our arteries, and decreases blood pressure. Parasympathetic slows our heart and calms us. And cardiovascular disease, still the number one cause of death, is very often tied to a person stuck in sympathetic overdrive. So we have to try to bring that into balance as much as possible volitionally. So there's some volitional things that you can choose to do to stimulate your parasympathetics and to calm your sympathetics. So that's, again, getting back to some functional neurology ideas that will help you do that. There's a lot of different exercises. I have multiple blog posts that I write about this that seem very silly little exercises that can help stimulate a person's parasympathetic and that can help calm the person's sympathetic. So doing those on a regular basis and learning lifestyle changes that will help with that, and understanding lifestyle choices that you've made that have caused a sympathetic overdrive, the stresses that we live under, trying to get that under control could be extremely helpful.
Yeah, that sounds like it is. And I think, I mean, there's nothing there I don't agree with. I think people are, especially as you said, in North America more than anywhere else in the world, it seems that we're living in this consistent, like, fighting a tiger state, right? And being able to consider pulling yourself out of that is something that a lot of people don't even go to. But it's one of those things that, I mean, as you said, it has such a profound effect on your health. And we turn a lot to the vagus nerve. We look at vagus nerve as kind of the answer to shifting that shifting you back into that parasympathetic, even going deep down to manipulating brain waves with different frequencies to try and pull people into that parasympathetic state. But there's a lot of, as you said, a lot of actionable things people can do to shift that without the need for tools. And we use tools a lot of the time. So you said you've got a lot of those tips and stuff on your blog, correct?
Yes. Yeah.
Perfect. So people will be able to check that out. We have the blog will be mentioned in the show notes for sure. So kind of my last talking point here I want to bring up is, this kind of ties into the parasympathetic, sympathetic state, but we know that people living with chronic pain have often suffered on the mental health side of things as well. They're dealing with a lot of problems. Family issues can arise from chronic pain, just in the struggle to get a support system going, and having an understanding of that. And so people's mental health ends up suffering a lot. Like, there's got to be something. I know that probably plays with cancer patients as well. We see that a lot with any that come to us that are dealing with cancer. The mental health is also a big thing. So you must be used to giving out advice there. But what sort of advice would you give out to people to kind of improve mood, mindset, et cetera, whether they're dealing with cancer pain or pain in general, I suppose?
Well, there's certainly lifestyle choices and changes that a person should make. You can't be in toxic relationships. You need to seek out counseling if you feel like you have things that you need to overcome in your past. You can't be living in shame and guilt. There's all sorts of things we can talk about for hours about that. From a chemistry side, there's things that a person can do as well. And I'm talking about just body chemistry, dealing with your to help balance your hormones. and balance your neurotransmitters. So from a chemistry standpoint, a great tool is the adaptogenic herbs. So herbs that are called adaptogens, and there's lots of different herbs in that category, can help just calm a person as well. I tell you, most of our cancer patients are taking that. A lot of the adaptogenic herbs help stimulate the parasympathetics and help you sleep better, because that's an issue with chronic pain as well. If you're not sleeping, then that's a major issue. So using adaptogens can be really helpful to calm that as well. But yeah, there's a lot of pieces of that puzzle when you deal with mental health of chronic pain. Chronic pain just drags you down the pit, and especially when you tie in the person isn't sleeping, you could have all sorts of mental health problems when you're not getting your sleep. So making sure that you are dealing with sleep properly, and sometimes you have to use things like CBD or even THC to help bring about a sleep pattern that can really help clear your mind.
It all seems like it's super important. And I know a lot of people, many of my listeners are hesitant to make lifestyle changes. They've told me that in the past. It's hard. It's a lot of work, and especially when they're already dealing with chronic pain. But we do have to emphasize the fact that, if you don't sleep, if you don't ever get up and move around and exercise, if you don't eat decently, at least, all you're doing is hampering your ability to heal, right? You need to be able to kind of get on top of all of these things to bring yourself into a better state. We even see as a huge connection between inflammation and mental health, right? There's a lot of the talk about inflammation being kind of one of the causes of even depression and anxiety as the brain itself becomes inflamed. And that's all tied into lifestyle, right?
Oh, it is totally. I mean, the brain inflammation is the key. And we see that a lot with cancer patients that have done chemo. So chemo crosses the blood-brain barrier often and damages microglial cells. So you got this ramped up brain inflammation that won't calm down. And that's the same thing can happen, post-concussion. They say, oh, I don't have chemo, I didn't do chemo. Well, post-concussion syndrome causes damaged microglial cells and chronic brain inflammation. Lack of sleep causes damaged microglial cells and brain inflammation, but also things like dietary peptides. So if a person has a hidden gluten sensitivity, so they have inflammation in the gut, that's going to fire inflammation in the brain, and that is going to be a source of damaged microglial cells and ramped up inflammation. So you have to take a broad approach to dealing with people with chronic pain. It's not about here, just take this supplement or use this therapy and it's going to take your pain away. You have to go, okay, when you're really asking the question, why do you have this pain, and digging into those root causes, you're going to uncover some of these things. Person has gut inflammation, gut damage of their gut wall that needs to be dealt with. Now they have dietary peptide antibodies of different foods. That's causing inflammation in the brain. This is why they can't sleep. This is why their pituitary isn't working well with their, hypothalamic pituitary axis. And this is why they have, thyroid issues and adrenal insufficiency and cortisol imbalances. And, it just keeps going on. And you have to kind of have a starting point, at least, of some of the things that the person will do to start breaking these things down, that you're going to have the best, long-term benefits that way.
Right. Yeah. This is so interconnected, and everyone's got to realize that everything that they do, right, has an impact on their overall health, one way or the other.
Exactly.
All right. Well, excellent. Well, thank you so much for joining us today, Dr. Connors. It was great having you on here. Different conversation than we had before, but still an excellent one as well. So thank you.
Thanks for having me. Bye-bye.
Yeah. To our audience, please make sure you connect with Dr. Connors. I'm going to include all of his information in the show notes at painfreeforlife.com/podcast. And until next time, I'm Dr. Rob Vanbergen, and you are listening to Pain Free for Life.
Thanks for listening to Pain Free for Life. Be sure to follow us, share the show with family and friends, and leave us a review on iTunes. Every time you share the show, you are helping someone take their life back from pain. Visit painfreeforlife.com for more resources, including our free guides to microcurrent, the Hache protocol and inflammation, as well as our blog and online community full of people just like you, successfully overcoming all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And stay tuned for the next episode of Pain Free for Life.